So we are going to look at the technique of cannulating. There are so many techniques. We are going to look at some of them today. First, when you're passing cannula, you tie a tonic weight, just as I've done, to make the veins more visible. Then you're going to identify the vein. If perhaps the vein you've identified is short, which is most common in children and elderly, you start from far, where there is no vein, as you go in. If you start immediately, the cannula will not enter, or you find there is resistance. Like halfway the cannula, you meet resistance. Then we have mobile veins, the ones which keep moving. You go from the side, but first pull the skin backwards and then you go straight. So when the vein is mobile, you first pull backwards and you then go from the side into the vein. So if the patient is round, you first go deep inside, then you straighten. If you go superficially, you're going to miss the vein and you're most likely to inflict a lot of pain on the patient. And for this case, this vein is very visible. In a round patient, you will not see the vein, and you must use your knowledge of anatomy and physiology to get to it. So that's why you have to go deep inside, because there is too much fat on the skin. Then if the vein is small, you use a small bore needle, a gauge like this 24 for the small veins. And that does not matter whether it's a child or an adult. Even an adult with a small vein, you use gauge 24, which is a yellow cannula. If the vein is crooked, there are those veins you find when they are going round. You don't pull the needle group much. So after entering, you don't pull the needle group much. You pull just a little to leave the needle to support, and then you go in. You will succeed.